Bleeding changes on contraceptives. Hello, welcome to our video series on contraceptive methods. In this video, I am going to talk about bleeding changes that can happen when you are using hormonal contraceptives or the copper IUD. These changes are common and normal with modern contraceptive methods. They may include unpredictable bleeding, more bleeding, less bleeding, or no bleeding at all. Women often have concerns about how their bleeding patterns may change when using contraceptives. Knowing what to expect can help you choose a method with changes in your bleeding pattern that you are okay with and may even come to like. Let's see what normally happens inside your body. Each month, soon after your monthly bleeding, your body prepares itself for starting a pregnancy. This is your fertile time. If you have sex with a man, millions of sperm swim up in search of an egg. In the middle of your cycle, an egg is released from your ovary and travels through the tube towards your uterus. The lining inside the uterus starts to grow to nourish a possible pregnancy. If a sperm joins the egg, a pregnancy can start. If a sperm does not join the egg is reabsorbed by your body. Now, you're no longer fertile. A few weeks later, since the lining in the uterus is not needed for pregnancy, you have your monthly bleeding. In order to prevent pregnancy, hormonal contraceptive methods can cause several changes in this cycle. First, ovulation can stop, so then no egg is released from your ovaries. Then, the mucus in your cervix becomes thick, which can prevent sperm from reaching the uterus and fertilizing an egg. And last, the lining of your uterus becomes thin, making it difficult to support a pregnancy. Women in their fertile years normally release an egg once a month and have a regular cycle of monthly bleeding, though the flow and pattern is unique from one woman to another. With most hormonal contraceptives, you no longer have a predictable monthly bleeding cycle. This happens because you have stopped ovulating, and so your uterine lining does not build up. While it may be reassuring to have monthly bleeding, there is no uterine lining to shed, so it is not necessary for your health to have a period of bleeding each month. When you start a hormonal contraceptive, such as the implant, the injection, the hormonal IUD, or the mini pill, you'll often have unpredictable bleeding during the first few months. After that, bleeding becomes less frequent and lighter. It's common for the lining in the uterus to become so thin that you may only have spotting. Spotting is very light occasional bleeding, often pink or brown, that may not even stain your underwear. Eventually, you may have no bleeding at all. This is safe and normal. Blood is not building up in your body. Once you stop using a hormonal method, your ability to get pregnant and your normal monthly bleeding pattern will return to what they were before you started the method. Every woman's experience will be different, but there are bleeding changes that are common to each method. The bleeding changes often improve over time as your body adjusts. Let's look at the common bleeding patterns with several contraceptive methods over the first year of use. The implant. Most women have irregular bleeding that can be heavy in the first few months. Bleeding usually becomes lighter and less frequent. It's common in time to have no bleeding at all. The hormonal IUD. Most women have irregular bleeding and spotting at first. That becomes lighter and less frequent. And over time, it's common to have no bleeding at all. The injection. It's common to have irregular bleeding that can be heavy at first. Irregular bleeding usually becomes lighter and less frequent. Eventually, many women have only spotting or have no bleeding at all. The mini pill. It's common for women to have spotting, especially if she is late taking a pill. Or she may have prolonged irregular bleeding. Over time, women commonly have shorter, lighter, irregular bleeding and spotting, and possibly no bleeding at all. Women who breastfeed will typically have no bleeding while using the mini pill. The copper IUD. The copper IUD has no hormones, so women will have a normal monthly bleeding cycle. In the first 3 to 6 months, it's common for her monthly bleeding to be heavier and last longer, with more cramping. Some women also have irregular spotting. The bleeding changes usually get better over time, and most women will return to their normal pattern within the first year of use. The contraceptive pill. Women have a regular monthly bleeding cycle caused by the decrease in hormones during the week she's taking the inactive non-hormone pills. In the first few months, it is common for women to have shorter, lighter monthly bleeding and occasional spotting, especially if she is late taking a pill. Over time, her monthly bleeding often becomes lighter and shorter. And some women may eventually have no monthly bleeding at all. Talk to your healthcare provider about what bleeding changes you can expect on your contraceptive method. Remember that bleeding usually gets lighter and less frequent over 3 to 6 months. The changes can be annoying, but they are safe and normal, and they don't make the contraceptive method less effective. Sometimes bleeding can be heavy and prolonged with cramping, especially at first with the copper IUD. See your healthcare provider. There are medicines such as ibuprofen that can reduce the bleeding and cramping. It is common for women on a hormonal method to eventually have no bleeding at all. This is normal, expected, and safe. Blood is not building up in your body. Many women are happy to be free of periodic bleeding, and it may even prevent anemia. If you are using a hormonal method correctly and consistently, no bleeding does not mean you're pregnant. However, no contraceptive method is 100% effective. So if you notice symptoms of pregnancy, such as breast tenderness, nausea, or fatigue, you should check for pregnancy. Once you stop your contraceptive, your monthly bleeding pattern will return to normal, as will your ability to get pregnant. Keep these points in mind. Bleeding changes with contraceptive methods are normal and not harmful. They commonly get better over the first 3 to 6 months as your body adjusts. Having no bleeding at all is also normal and safe. Blood is not building up in your body. Expect some bleeding changes on your contraceptive method and give your body a little time to adjust. But if you're not happy, there are other good options. It's important to find a contraceptive that works best for you. You're worth it.